when you think their wedding is now only 6 weeks away. Rhiannon Mills, Sky News in Bath.
A new sugar tax comes into force today, leading to a hike in prices for some fizzy drinks and juices. The aim is for the higher prices to put consumers off buying the most sugary drinks, hopefully leading to a decline in obesity and teeth problems, especially in children. And some dentists are calling today for the money raised to be used to fund lessons for children on how to brush their teeth properly. We're joined now by a dentist, David Gray. David, really good to see you. Thanks for coming in this afternoon. Will it make us healthier?
I hope so. I certainly hope it will make a big difference, both from the obesity side of things, but definitely from a dental perspective. We have, on average, every 10 minutes, one child is being taken into hospital to have teeth removed. Last year, there were over 40,000 cases of kids having teeth removed in hospital, all due to preventable decay. And if we can take any measures to try and reduce the sugar consumption and lead to a reduction in these side effects, it'll be a big benefit.
Are you concerned at all that you're telling people how to live their lives? I mean, the vast majority of people aren't obese, don't have bad teeth. Why should they suffer?
The majority aren't, but a significant number are. Something like 1 in 5 children are obese within the UK at the moment. Over 2/3 of adults are overweight. Obesity is a huge problem. Now, I can only tell you from the dental side of things how this is impacting us, but we know that it has huge ramifications on children and the potential outcomes, including fillings, extractions, and the knock-on effect it has in life.
Have you seen a rise?
Personally, I've seen a high number of kids coming through the doors with decay consistently throughout my career. Now, I'm fairly young in my career, so I couldn't quantify if there's been a rise or not. But we know back in 2012, 2013, there were only 36,000 who had teeth removed in hospital. Last year, we had 43,000. It's dropped a little bit this year, but that is still staggering numbers of children having teeth removed. And the data speaks for itself.
Why do you think it varies so much in terms of tooth decay where you live in the country? Say, for example, a child living in Lancashire or Cumbria are twice or 6 times more likely to develop tooth decay than a child, say, in Wessex.
Well, there is a big education part of this. A lot of people are simply not aware of the impact of sugar and how it causes damage to both our bodies and to our teeth. And that is reflected by socioeconomic status. In poorer areas, there's higher levels of decay than there are in more wealthy areas. One of the big problems we have at the moment is not just these fizzy drinks, but other sources of sugar. Healthy alternatives such as smoothies, they have as much sugar as a can of Coke or sometimes even higher, and yet people are going on these health kicks, which means they consume high volumes of it, leading to just the same problems.
You've brought some props with you, I see. Just give us a demonstration of how best to brush your teeth, how you're supposed to do it, because I look back to when I was a youngster and I'm not sure, I can't remember, I've been racking my brain whether there was ever a point when I was at school in class and somebody came in and said, kids, this is how you brush your teeth.
No, and while you mention that, actually, that would be a really great thing for us to see more of. We know that this sugar tax will potentially raise £240 million for the government each year, which, being an obesity-driven tax, is primarily going on obesity-fighting measures. If we can get some of that redirected to dental education, that would be fantastic. Teaching teachers how to deliver oral health care and supporting families in order to delivering the best care for their children.
It shows how you do it.
So, taking your toothbrush, we're going to angle in at 45 degrees to the tooth. Short backwards and forwards motion, little round circles on the sides of the teeth to make sure that all of that plaque is removed. Now, one thing that we have to remember is that every surface of that tooth needs brushing. So once you've done the outside, we need to be moving on to the biting surface of the tooth and then the inside, making sure it gets brushes are really good things for the kids to be using as well. One of the big benefits is that it has a timer. We want children to be brushing and adults to be brushing for 2 minutes twice a day. And too often children aren't simply spending enough. They think they've got bigger and better things to do. If we can get a child to brush for 2 minutes, that'd be the way to do it.
Good advice. There you have it there. Brush your teeth twice a day, 2 minutes. David, good to see you. Thank you.
Thank you very much.
Let's have a look at what the weather's going to solve for us.